Good morning, assalamu alaikum, spacher. Today I am going to speak to you about a very interesting neurotransmitter in the brain. It's called dopamine. And so first of all, I'm going to tell you that it's a neurotransmitter. And a neurotransmitter, it allows chemicals to be sent from one neuron to the next. And basically this allows for neuronal function in various ways. And we're going to speak about the three different dopaminergic projections and what they do, and then you'll understand why this is so important. So first I'm going to show you this, this really nice illustration. Right here where I'm pointing is the top of the brainstem. This is called the midbrain, or also called the mesencephalon. If you were to go downward, you end up in the spinal cord, and if you go upward, you end up in the brain. So right here where it's orange, this is the mesostriatal or nigrostriatal projections. And this is where the substantia nigra pars compacta lives. This is where Parkinson's lives. When this area doesn't work, we end up with tremors. And so this striatal system here, this where the putamen and the caudate live, if this doesn't work, we end up with movement disorders like tremors and ways that we walk, so our gait can be affected as well. And so this is what I look at clinically in my practice. The next one I'm going to talk about is very much emotionally based, but it's also related to memory as well. And this is called the mesolimbic projection. This goes from the ventral tegmental area right here in the mesencephalon. But when people don't have enough dopamine, they can end up with tremors, and they can end up with abnormal gait, and they can end up with an emotional escape. So if you ever meet people, they just start crying all of a sudden, or they just start laughing uncontrollably, that's related to this part of the brain right here. And then we have the mesocortical section, which is going up into this prefrontal cortex. This is where your personality lives. This is where your intelligence lives. This is where your ability to connect with other people lives. This is where your ability to have executive function lives. This is where you are able to plan something and accomplish it. When we think of successful people, we always think about the prefrontal cortex. So what's interesting is that the prefrontal cortex has the ability to inhibit these other two areas. So if you have limbic escape or you have tremors, if we activate this prefrontal cortex, oftentimes these things are managed and they don't show themselves as much. So from a neurological perspective, this is how I view all of these, but all of these are dependent on dopamine. So what are the symptoms of not having enough dopamine besides some of the things that I already said? So if you're tired all the time, that could be related to not having enough dopamine. If you have a lack of motivation, that could also be related to dopamine. Or if you have a low sex drive, or if you have disturbed sleep or insomnia. If you suffer from anxiety or depression, that can be related to dopamine. Now also serotonin is a lot of overlapping symptoms go back to serotonin, so make sure you watch the video on serotonin. But also if you have poor concentration or if you have ADD or ADHD, that's definitely going to be dopamine. If you don't experience pleasure, or if you have hopelessness, or if you don't feel loved. Now you can know that you are loved, but you may not feel loved, and that's dopamine. So let's talk about some of the mechanisms of how this can happen. So there's a lot of them, actually. And so if any of these are involved, and especially if you have a lot of them, then that can compound the problem. Now also keep in mind that some people don't have as much of these tissues because they're not born with as much, or if they have neural degeneration, they don't have as much of these tissues. So when we want to resolve this problem, we have to, number one, be able to make dopamine, and then you want to exercise the parts of the brain that allow for maximum function. So If you don't have enough vitamin K2, which the best source in my opinion is cruciferous vegetables, that will affect your ability to make dopamine. If you don't have enough calcium, or if you don't have enough vitamin C, or you don't have enough iron, or if you don't have enough vitamin D, which around here, lots of people don't, and if you don't have enough magnesium, all of these things will affect your ability to synthesize dopamine. If you have elevated homocysteine because you have poor methylation, that will affect it as well. If you don't have enough vitamin B3 or B6 or B2 or B12 or folic acid, all of these things will affect your ability to synthesize dopamine. If you have any kind of liver problem, like a fatty liver or anything like that, then it'll be harder for you to make dopamine. If you have a poor breathing mechanism, so like if you have any kind of COPD, or if you have asthma, then that will affect your ability to make dopamine. If you have a low thyroid, or if you use antacids, or if you have gut problems, such as too much yeast, like if you have a yeast infection or yeast overgrowth, or if you have Helicobacter pylori, so if you're having ulcers or acid reflux, those are signs that you probably aren't also making dopamine as well. By the way, a very important thing I should tell you, dopamine also lives in the gut. So if you don't have enough of it in the gut, it will affect the brain, and vice versa, through these chemokine messengers that travel back and forth between the gut and the brain. So it's very important that you have this. Now, if you are eating animal proteins that are not organic, then you're getting antibiotics in your food. And if you're getting it in your food, you're killing your gut flora. So you should definitely be taking probiotics regularly so that you can have healthy gut flora. So another thing I'll tell you is if you have a problem with, if you're not getting enough tyrosine from your diet, or if you have hypochlorhydria, so you're not making enough stomach acid, if you take oral contraceptives, that will affect your ability to make dopamine. If you are on estrogen replacement, that also will affect it as well. So that's a lot of different mechanisms. So any of those things can give you those symptoms that I told you about previously. So the solution, in my opinion, is looking at your blood work to figure out what things are not working out so that we can change those functionally. Also, becoming more physically active helps as well. It stimulates dopamine. Also, there's a supplement called Dopatone. I like it very much because it has all the cofactors and precursors that you need so that you can make it and use that supplement as a crutch until you're making it from your lifestyle. Also, giving people frontal lobe exercises via the eyes will also help with, a lot of these symptoms. So we want to activate the tissue, and we want to actually make dopamine. There are, medications that you can also take. I don't like them very much because they have all kinds of symptoms and side effects. I won't even get into all of them, but it really, sometimes it's the best choice, especially if people are really, really doing poorly. But what would make more sense is to eventually help them start making their own dopamine. One other thing I'll say is that people that are addicted to, people that have addictions and struggle with those addictions, usually they also don't have enough dopamine. And so what they're trying to do is they're trying to stimulate a little bit of dopamine release, and so that's one of the things that keeps them addicted. So if people suffer from addictions, we really want to make sure this whole thing is working for them. So I hope that is helpful information, and I hope that I can encourage you to work on your brain and make sure it's healthy and your gut as well. And I will catch you next time.